All right, it's time to do another summer sesh with Dr. Melanie Palm, and we got Kristi Cashman, who's our non-invasive body contouring expert. And as we promised last week, I think it's been about a week, we thought we'd showcase some of the procedures we do here in the clinic, and I think I really try and talk the talk and walk the walk, so we thought we would demonstrate my second VI peel of the summer. So right now I've washed my face, we got the makeup off, and right now we're doing something called degreasing the skin. This is really important with chemical peels, and this strips the skin of some of the natural oils, because when we're applying chemical peels, we want really even application. And if there's oilier spots like our T-zone and not so oily spots like the lateral face, we can cause uneven sort of results. So this is a really important step. Acetone, as I'm sure you're super familiar with, nail polish remover, it's that familiar scent. And then we're going to be doing something called the VI Precision Plus peel. So Kristi, maybe talk a little bit about it, because you've been doing tons of this during the summertime.
It's fabulous. It is specifically for pigment and helping with hyperpigmentation and or melasma, which is a hormonal pigment issue. And basically it has several different chemicals in it, along with hydroquinone, which is going to help suppress melanin. So being in the sun, as we are here in San Diego, it helps to sort of quiet the melanin down so that when you're in the sun, it doesn't come roaring to the surface. And then we're also, the different chemicals in the peel are going to exfoliate off the stratum corneum, or the top layer of your skin, so you get a nice, even, beautiful, brand new layer of skin under there.
So this is, what's interesting about this is some of the ingredients. Maybe we can go over some of the key ingredients and talk a little bit about it. So
absolutely.
Let's talk about phenol first.
So phenol basically is one of the more powerful chemical peels that you can actually do on its own, but mixed into this chemical peel, this is a medium depth chemical peel, so mixed into here, it actually acts as almost like a topical anesthetic. So when we put the first layer on, it can be a little spicy, but it actually helps to numb the skin so that the rest of the layers aren't so spicy, and it's very, very tolerable.
Yeah. So phenol is one of our deep peeling agents, and if you're actually doing a true phenol peel, this is something we almost do in an OR setting. We have to do cardiac monitoring. You can only do segments of the face. People have about a month of downtime. What's really interesting in this blended peel, so this particular formulation has phenol in it. Doesn't it have retinoic acid in it? So it's got, what kind of tretinoin is, or retinase active ingredient. It has hydroquinone, which is the gold standard for a brightening agent. And then this one also has a couple of additional ingredients too.
It has some TCA.
Yep.
And it has salicylic acid.
So those are really important things. We'll go through each of these. Phenol, it's at a lower concentration, and it helps sort of break down some of the cell-to-cell bonds, and that's how it sort of renews the skin. It causes a controlled damage of some of the skin. It's interesting in that this doesn't hurt at all. This will be my third or fourth, I think, VI peel. I'm trying to be a little more consistent, and similar to patients, we're going to do a series of 3. I'm doing my second out of the 3 monthly ones that we do. And it smells a little sweet. It really doesn't hurt. I'm going to do it in real time. I'm not the bravest agent, bravest patient. So you can go ahead and apply. Are you applying the first pass?
Here's the first pass.
And I've got this amazing little wand fan that's great. So that just helps distract the skin. The retinoic acid, we know this is a vitamin A derivative. We use this topically in a lot of our skincare, and it helps with turning over skin a little bit more frequently. It does a lot of things to normalize how pigment is produced. That's important when we're using something like the VI Precision Plus, where we're really trying to target sort of pigmentation. And retinoic acid has been studied for, 5 or 6 decades, and it builds collagen, it fights fine lines, it helps with pigmentation, it prevents precancerous spots if used regularly. And in something like a peel or in skincare, it can also help other small molecules penetrate more consistently and more deeply in the skin, which is why it's such a nice sort of additive. Salicylic acid is known as a beta hydroxy acid. So we use this. It can be helpful for acne. It's folliculocentric, so it means it actually gets down the hair follicles and the oil glands. It degunks some of that. So if people are dealing with post-inflammatory hyperpigmentation and acne, it can be really helpful with that. But it also helps with sort of, as a peeling agent. It's a superficial light peeling agent. So that's kind of its main component with this. Hydroquinone, as I mentioned, is sort of the gold standard for brightening agents. We use it in our topical peeling pads. It's a gold standard treatment for many of our melasma regimens, and it helps sort of interfere with abnormal pigmentation and tyrosinase activity, which is part of sort of the metabolic activity of some of our melanin producing sort of agents and cells that are in our skin. And then finally, TCA is trichloroacetic acid, and this is a medium depth chemical peeling agent, and it's keratolytic. It helps sort of break down some of the cell to cell sort of bonds, and again, it helps as a peeling agent. It's typically medium depth, which means it can reach the dermis, but you can see I'm very comfortable. I've been talking through all this. It's really not even spicy as I'm doing it, which is great. You want to see hopefully we get a little bit of frost. I don't know what's happening with my skin, so maybe you can tell me what you're seeing.
Yep, just a little pink right now, and just the cheek area. But other than that, not a whole lot.
And how many peels do you usually do in a session in terms of like how many passes?
Yeah.
I should say.
Oh, how many passes? So I use the entire vial. So it depends on what how big of an area I'm doing, and most likely it'll be anywhere from 4 to 6 passes. So or sometimes I'll do 5 passes and then the 6th on just the problem areas. It really is kind of tailored to the patient as well.
And when you say problem areas, tell me what you mean. Is that pigmentation or there's certain areas? Got it.
Yeah, exactly. So if someone has melasma, a lot of times it's out on this outer area or the upper lip or the forehead, and so I'll do an extra pass on those just to really target those problem pigment areas.
And it's every day that I talk to a melasma patient. I have melasma myself. Being in, we were in the state of California. We were regulated to have masks in healthcare facilities for I think over 3 years. It was like 3 years and a month.
Forever.
And because of being in that mask, we know heat and inflammation, so just exhalation of my warm breath in the mask caused pigmentation in my central face, which is called central facial melasma. Sorry, I'm just trying to not breathe in while I'm doing this. No, it's totally fine. And so I do really good skincare. We talk about foundational melasma treatment is topical skincare. And so one of the things that we can do is a peel, right?
Yes, absolutely. It's a great additive to good skincare at home. We also have lasers that Dr. Palm does that help with melasma, but adding all of those in together is kind of a really good arsenal for...
we have so many patients that are enjoying like summertime and maybe they've got a little color on their skin. We don't necessarily want to do some of the light and laser-based technologies that we normally do more during fall and the wintertime and during the spring. But this is something with pretty minimal downtime. If they can stay out of the sun for a couple weeks, I think is a nice adjunct to keep their skin healthy, to promote collagen growth, to help with some of the abnormal pigmentation. So we've been doing more of these peels that we're doing summertime as a result of this. And so, with my melasma patients, we get them on really good topical skincare. That oftentimes will help treat it. This is one of the things that we can add on. We have a laser called Spectra laser we sometimes choose as well. There's even oral medications, an antioxidant supplement we talk about. There's a prescription medication called tranexamic acid we use in very special cases. So I think melasma is not like formulaic. We definitely create sort of a bespoke treatment regimen depending on what the patient needs are. Are they someone where heat and aggravation is really the key issue? Is it deeper pigmentation? Is it more superficial pigmentation? Or is there a vascular component? We know blood vessels are abnormal in patients that have melasma, and so sometimes I'm even adding in topical medications or things that I'm calming some of the inflammation related to the blood vessels. So we've done 2 passes right now?
2 passes,
About to start a third?
Yep, let's go. So the other thing with the aftercare is really interesting with the VI peel. You get a little kit to take home, and you actually have homework with this peel. So there's these little peel pads that actually add to the strength of the peel. peel pads that contain some retinoic acid and some hydroquinone. So you're actually for 2 days adding to the strength of the peel. And the other thing that's important with aftercare is, again, that you are able to stay out of the sun for a few days while you're actively peeling, and then also able to take some time off exercise, because we don't want anybody getting too warm or too sweaty, because it lifts the peel a little too soon.
And this comes with a super simple app, and it also comes with the kit of all of this aftercare. So, you know, the products that include the retinoic acid, there's a sunscreen, there's a moisturizing balm that has a little bit of hydrocortisone. But interestingly, there's a couple of products that I tried last time that I did as kind of a beta test, and we're recommending for patients, because we used to tell them, look, today, tomorrow, it's really not going to look any different. I've worn, you know, my tinted sunscreen over it. People haven't known I've done anything.
Right.
But day 3 through 5, you used to peel quite a bit with this. But we are now using something called CMT cream. This is a product from Revision. It was developed for C, chemical peels, M, mechanical, for things like microneedling, and T for thermal, so things like laser and light treatments that we're doing, radio frequency treatments. We are using this on every patient with every technology or chemical peel that we use. And it helps with redness, it helps with swelling, and it helps with any discomfort immediately post-procedure. And we really have gotten phenomenal feedback from patients, whether it's chemical peels, things like IPL resurfax, non-ablative lasers, my PDT patients, CO2 laser resurfacing patients. So I used this last time, and I found that I had much less peeling.
Yeah.
You don't have to peel for a chemical peel to work. And then the second of patients doing laser resurfacing, patients doing PDT, and now with this peel for the VI, either peel or Precision Plus peel, is Secura Silk, which is a gommage. And this is a gel product that after you're done cleansing on moist skin, you put about a silver dollar size amount in the palm of your hand, apply that to the skin, and it links onto the dead keratin and just creates pilling of this sort of dead skin cells. And I think that helps so much with some of the sheets of peeling that we used to have. So I really found that I had pretty minimal peeling. You know, the first time I did this, there was quite a bit of peeling first around my perioral area, so the area around my mouth. It happened several times. I just didn't have that this time. And I really credit that to these 2 new products. They're not new products. One is new, the CMT cream, but Secura Silk we've used for other things. But I think it really reduced the amount of downtime we had, because I think that's the one pushback we get when patients are interested in chemical peels, but then they have issues with sort of like, well, how much downtime do I have? I think these are products that we can really help usher a faster recovery, but not compromise results.
Yeah, and you're able to go back to work, you know, and not have everybody know that you just had a peel. I used the CMT. I used them both after my last peel as well, and I found that because I sometimes get a little stingy when I'm peeling the brand new skin, and the CMT was huge in helping with the comfort afterwards. I just didn't have that stinginess.
Yeah. So this is round 3?
This is 4.
Oh, 4. Okay.
Yeah.
So I've been so busy chatting that so, you know, again, super easy. As Kristi was mentioning, we're going to do 4 to 6 of these afterwards. We're going to apply some of the CMT. So I don't know, how much of the vial do you have left product wise?
I probably have 2 more passes.
Yeah. But, you know, again, not uncomfortable. I mean, this is like right now a 0 out of 10 pain score wise, I would say. I don't know, you know, I can't see my own skin. So is it pink? Are we seeing any frosting yet?
Pink. I'm not seeing any frosting.
You know, and I don't stop my retinoid. I know this is like sometimes a stylistic thing, but we typically do not recommend stopping if you're using a retinoid or a retinol at night. It is actually good pre-treatment. It helps your skin turn over a little faster. I think you heal from the peels a little bit faster. So that's something I really don't have patients sort of change or alter their skincare the night before. We just prep the skin the day of to make sure makeup is off, that we get the any oils off the skin off. So we're again getting a really nice even application of the chemical peel.
Can I press a little harder this time?
Yeah.
Okay. So sometimes when you press the peel into the skin, you get even more of a reaction.
And then do you use the app, Kristi?
I actually don't myself, but I do tell patients about using it.
Yeah.
So yes, I give patients the option. I do write everything out for my patients also, just in case they need sort of a backup. Yep. But I just kind of, there's actually a little pamphlet in the little aftercare kit that we can use, and I just add a little bit to that to remind them of a few things, and then say there's a little QR code in there that they can use for the app. The app is actually really nice. It reminds you of what time to do what, and you can take
photos,
yeah,
right?
Take selfies so you can see your progress. So it is really a nice feature.
And then, what we typically do and what the manufacturer's recommendation is to do this as a series of 3 treatments. You certainly can do more. So usually the first series of 3 is spaced a month apart, but certainly you can do maintenance treatment if you wanted to. So, we are exposed to sun a lot. Even on the cloudy days, there's 80% of the UV radiation still making its way to the surface of, the earth. So I really, this is something I'm trying to do, kind of a re-series, but wouldn't be something bad if you wanted to and like the idea of peel or struggling with pigmentation, want something to help with sort of fine lines, textural changes, collagen boosting. You certainly could do once a quarter if you wanted
that's
to.
What I was thinking is, the initial series of 3 and then once a quarter would be a great maintenance plan.
And then we're doing our 6th and final pass.
Yes.
And again, not painful. I tend to have pretty reactive skin, so I'm sure it's getting pink.
It's getting pink, but it's not outrageously.
Yeah. And then when you see patients back after the first time, tell me what that experience is like when they tell you about aftercare. When do you normally start to see some changes in the series?
In where they're
improvements?
Oh yeah. I would say usually after the second one is where you see more improvement. After the first, it can be on the lighter side. I tend not to be really aggressive on the first one for patients who are new to it, just so that they can kind of get a handle on it and we can see how their skin reacts. But you do get a result after every one. I do take photos after every peel to make sure that we're doing what we want to do. And everybody's a little bit different in how they react too. There are patients who peel in sheets, and there are patients who just flake. There are patients who barely get any peeling at all, and they all get a benefit from the peel no matter where they are on that scale.
And then is the face the only area you can treat?
Actually, no. We can actually treat almost anywhere. We can you can do your hands, you can do the neck, you can do the décolleté. We have the capability of doing other body parts too, if people are interested in that. So yeah, you can do almost anywhere with the VI peel.
Awesome.
Yeah.
And then aftercare, once we've applied the 4 to 6 passes, we've done 6 on me today.
Exactly.
Is this when you apply CMT, or tell me aftercare stuff?
I don't do the CMT right afterwards because you want to leave this peel on for 4 hours before you wash your face for the first time.
Yeah.
So we leave it sort of like this. You walk out with a little bit of a tan.
Yeah.
And 4 hours later is when you do your first wash and apply actually a peel pad that comes in the aftercare kit. And then right before bed, you're going to do your second wash and application of 2 different kinds of peel pads, the retinoid and the hydroquinone pad. So you'll do those right before bed, about an hour before bed. And then tomorrow you're just going to feel nice and tight, and but shouldn't have any visible signs of the peel. You can put on makeup tomorrow with no problem, and it does come with some products in there that you can use. So a gentle cleanser, a hydrocortisone cream if necessary for any irritated areas, and a sunscreen, a physical sunscreen. I can also have patients use the sunscreens that they're already on if they're on a physical block already. So tomorrow morning it'll be just wash and sunscreen or the CMT.
Yep.
And then tomorrow night you'll do a repeat of tonight, which is washing and 2 of the peel pads, the retinoic acid and the hydroquinone. And then you can use your CMT. And then day 3 is normally when you start peeling.
Yeah.
So around day 3, you will start peeling mostly around the mouth because that's where we move so much. And then it works its way outward. So days 3, 4, 5, usually you're peeling here and working its way outward. Around day 7, you just might be flaking around the edges a little bit.
And again, when you start to see that peeling or the skin feels rough is when I've started, after washing, starting to introduce the Secura Silk.
Right.
And then the CMT, as long as you're pink, if you notice a little swelling, have a little bit of redness, I think is something we can layer on before we're, either in conjunction with the hydrocortisone balm, you can mix the two of them up a little bit, but before you're applying sunscreen or any makeup over it.
Exactly.
Yeah. So that's it, you guys. I mean, I wanted to show it's simple and easy. I think, patients often ask about chemical peels, and I think this is a super safe one that's got really good active combination of treatments, but causes really, what I used to view as pretty minimal downtime peeling day 3 through 5, but I think with some of the innovations and sort of adaptations we've used in terms of some of the newer products we have available, we can minimize even the amount of expected peeling that we have with this. So we minimize some of that downtime that patients have from return to social activities. So if you have questions, you want to ask about the VI Precision Plus Peel, we are closed for the evening, but you can call us, it's 858-792-7546, or check out our website, which is www.artofskinmd.com. Hope you guys have a great night.
Have a great night.